Okay, well, good afternoon and welcome to the public health media availability for this week. As always, Dr. Ferrer will make some comments and then we'll answer your questions. If you would like to be put into the queue to ask a question, please click on the hand icon, which is in the participant panel, or you can also send me a message through our chat, after which at about 3 o'clock, we will make remarks in Spanish. So with that, Dr. Ferrer, I'll turn things over to you.
Thanks so much, and thank you everyone for joining me for today's briefing. This afternoon, I'll be talking about our trends in cases, hospitalizations, and deaths, and I'll provide an update on cases, hospitalizations, I already said that, and an update on vaccination coverage, information about the Delta variant and post-vaccination infection cases, information about work site compliance, and information about how we can work together to protect workers. I'll take the first slide. We are continuing to see a rise in transmission countywide, although our rate of rise slowed compared with last week. Today we're reporting 3,248 new cases. This represents a 17% increase over last week, and it brings the total number of cases in LA County to 1,276,137. You may recall that last week's number was an 80% increase over the week prior. Our daily average case rate without the 7-day lag is now 15.7 cases per 100,000, and that's an increase from last week's case rate of 12.9 new cases per 100,000. To date, nearly 7.3 million people have been tested and had test results reported in LA County. Our daily test positivity rate is 5.17%. This is an increase of less than half a percentage point from last week's rate of 4.73%, which was itself an increase of nearly a full percentage point over the previous week. This suggests to us that perhaps the rate of increase may be stabilizing. There are 918 people currently hospitalized with COVID-19. This is an increase of 273 people over the past week. And as a reminder, hospitalizations lag slightly behind cases, and we'll continue to see, we believe, increased hospitalizations for some time to come. There are currently 150 open investigations at residential congregate settings and non-residential settings with at least one confirmed case of COVID-19 at each site. I'm sad to report 17 additional deaths today. 16 of the people who passed away had underlying health conditions, and this brings the total number of deaths to 24,675 across LA County. We share our deepest condolences with those of you who have lost friends, loved ones, and families, and we wish you healing and peace. We'll take the next table. As you can see from this table that shows the CDC indicators and thresholds for community transmission of COVID-19, transmission in LA County is now at the high level. We have, as I just noted earlier, more than 14 new cases per 100,000. We can go on to the next slide. With widespread transmission now county and nationwide, we remain focused on mitigation strategies we have available to reduce the spread of the virus. Vaccinations remain the most powerful tool we have for lowering viral transmission. In alignment with the CDC and the state, we're committed to ensure easy access to vaccines and to build vaccine confidence by answering our community's questions and providing high-quality information on the science behind the vaccines. Universal masking is another key strategy for reducing transmission of COVID and other respiratory viruses. With mounting evidence that the Delta variant is contributing to high rates of infection and that it can be spread even among fully vaccinated people, both the CDC and the state now recommend masking in all indoor public spaces for everyone, regardless of vaccination status, affirming that masking is something we can and should all do to keep each other safe. Testing and contact tracing are the third critical part of our approach to slow the spread of the infection. Both help us identify the people at greatest risk for spreading the virus to others, and they give us the opportunity to educate those who test positive about keeping themselves safe and preventing onward transmission to people both within and outside of their households. Together, these three strategies comprise a simple but powerful toolkit that we're using to getting back to slowing transmission. And everyone has a part to play, helping to educate about vaccine safety and importance, wearing the appropriate mask when indoors at workplaces and public places, getting tested if you have symptoms or had an exposure, and participating in public health follow-up if you test positive or you are a close contact. We can go on to the next slide. This graph shows the trends in cases, hospitalizations, and deaths in our county from the beginning of the pandemic through July 21st of this year. Cases that are represented in the green trend line have been reported at an average rate of about 2,500 cases a day for the past week. This is slightly lower than the average number of cases we reported during last year's summer surge. Hospitalizations, as you can see on this graph, rise as a lagging indicator compared with cases, usually increasing about 2 weeks after we begin to see cases increase, and in the past, multiplying in direct proportion with cases. We're not currently seeing that pattern replicate itself during our current surge of cases. Although cases have increased by 740% over the last month, hospitalizations have increased by 180%. Fewer of our cases are becoming severely ill. Currently, 0.21% of positive cases are hospitalized, and this is much lower than the almost 6% of cases that were hospitalized during the winter surge. We're also learning that not all hospitalized patients who test positive for COVID are hospitalized with COVID illness. Some of the people included in this number are people hospitalized for medical procedures and other care who are discovered to be COVID positive through routine admission screening. However, the data we have so far suggests that most of the increases seen recently in hospitalizations are due to people being hospitalized for COVID illness, and that a significant proportion of them, once again, are requiring ICU care. Although our 7-day average number of deaths, which is represented here by the blue line, has not begun to significantly increase, we've noted a concerning increase in our daily numbers of deaths. We'll be gathering more information about these and those people that we've sadly most recently lost, and sharing what we learn about these new deaths as we do our best to prevent this most tragic outcome. We'll take the next slide. We've been detailing the rise of the Delta variant among strains sequenced in the LA County area for weeks. As we know, this now predominant strain is more efficiently transmitted between people, likely due to its faster replication, higher viral load, and greater affinity for lower respiratory tract cells compared with earlier COVID strains. And while emerging data affirms that fully vaccinated people are well protected from severe infections with Delta variants, people with only one vaccine are not as well protected, and a small number of fully vaccinated individuals can become infected and are able to infect others. This trend line shows the trajectory of the Delta variant among specimens sequenced by several labs serving Southern California, including LA County's Public Health Lab. The number of sequences collected between July 18th and 24th that had Delta variants isolated was 675. This is 96% of all sequences collected that past week. The trend in Delta predominance is represented by the blue line on this table. This is consistent with the rise of Delta nationwide. Last week, the CDC estimated that Delta strains accounted for 83% of circulating COVID. Given that we still have close to 4 million residents across the county not yet vaccinated, this risk of increased spread from this variant within our county remains high. We can take the next slide. Increased circulation of the highly transmissible Delta variant is leading to case increases across all racial and ethnic groups. This slide shows case, hospitalization, and death rates by race and ethnicity from the 2-week period that ended on June 19th, alongside these same metrics a month later for the 2-week period that ended on July 17th. In keeping with the recent trends, over the month preceding July 17th, all groups saw an increase in cases, with the highest case rate observed among Black residents, whose case rate rose from 43 cases per 100,000 people to 181 cases per 100,000 people. This is an increase of 320%. We also saw significant increases in the case rate for all other groups, with increases of 182% in Latinx residents, 361% among white residents, and 371% in Asian residents. It's notable and deeply troubling that the more recent case incident rate in Black residents is now more than twice that of white residents. And it's also important to note that now white residents, who have traditionally experienced lower case rates than Latinx and Black residents, are the group with the next highest case rate. Over the same interval, hospitalization rates have been trending upward by 35 to 90% in Black, Latinx, and Asian residents. And we've seen deaths begin to trend upward among Black residents by 71%. We can take the next slide. It's really Black, Latinx, and white and Asian residents have all seen deaths trend upward. This slide shows how the surge in transmission is happening in different cities and communities across the county now than it was when we're compared to communities hardest hit during our winter surge. On this map, cities and communities that had the top 20 case rates in the 2 weeks preceding January 12th of this year are marked in green. As you can see, these largely included neighborhoods in and around the northern San Fernando Valley, South LA, our most north county communities, and other areas with high concentrations of poverty. Meanwhile, cities and communities that now have the top 10 case rates are marked in orange. And as you'll note, these areas are located west of the formerly hard-hit communities and generally are more affluent areas. This geographic difference in communities with high case rates now compared with what we saw during our winter surge really creates differences in who is being affected. So far, it does appear that transmission in these neighborhoods is being driven mostly by community spread among young adults. We're continuing to work to understand how small outbreaks in these communities might also be contributing to high transmission across this set of neighborhoods. You can go on to the next slide. Given the high rates of community transmission really across the board at this point, our vaccination efforts remain critically important to reducing the impact of rising infection among our residents. As of July 25th, we've administered nearly 11 million doses to residents 12 and older, including more than 6 million first doses and nearly 4.9 million second doses. This means that more than 6.1 million LA County residents have received one dose, and almost 5.4 million are fully vaccinated. We'll take the next slide. This slide actually shows how we're doing vaccinating specific age groups of LA County residents. As of July 25th, we vaccinated 90% of LA County residents 65 and over, 71% of residents 16 and over, and 70% of residents 12 and over. We've also vaccinated 50% of LA County teens between the ages of 12 and 17. And out of our nearly 10.3 million LA County residents, including those not yet eligible for the vaccine, 60% have received at least one dose and 52% are fully vaccinated. We'll take the next slide. For the second week in a row, we saw an uptick in first dose recipients after weeks of steadily declining weekly vaccination numbers. Between July 19th and 25th, we administered just about 70,000 doses across the entire county network. And this is an increase of about 7,500 doses from the previous week. And this, I want to note, is the second week that we've seen this increase in vaccinations. And we remain immensely grateful to everyone in this county who's done and continues to do their part by getting vaccinated. Our sense of urgency to increase vaccination among our residents remains high, and we're grateful for these signs of increased vaccination uptake. Take the next slide. Although we do continue to have large gaps in vaccination between age and racial and ethnic subgroups, the uptick in vaccinations these past 2 weeks allows us to see changes in many of the groups with lower vaccination coverage. The numbers on this slide are now color-coded to show the changes in the past week. Proportions that increased by 1 point since we last reported them are listed in blue. Those that increased by 2 are listed in green, and those that increased by 3 are listed in pink. Proportions that didn't change at all are in white. Disproportionalities remain, as it's apparent when you look at this slide, especially among our teens and young adults. Among both the 12 to 15 and the 16 to 17 age groups, about 1/3 to 1/2 as many Black and Latinx teens, and about 2/3 to 3/4 as many white and American Indian Alaska Native teens are getting vaccinated as their Asian counterparts. However, with the start of the school year approaching, we're glad to see large increases in vaccination across racial and ethnic subgroups in teens ages 12 to 17. Meanwhile, among young adults 18 to 29, and 30% of Black adults and 45% of Latinx adults have been vaccinated, and this is compared to 60% of white and at 78% of Asian residents, between 1/2 to 2/3 fewer. This disproportionality also persists among our 30 to 49-year-olds. In this group, vaccination rates among Black adults are 1/3 to nearly 1/2 lower than rates among their Asian and white counterparts. However, as you can see, we saw increases in most racial and ethnic subgroups of these age groups. Looking at the totals by age group running across the bottom of this table, you'll note that vaccination rates are generally higher in older age groups. And with the transmission on the rise, we're particularly grateful that so many of our older people are protected by vaccines. And while we're glad to see the gains among younger adults, we need the vaccination levels to rise much higher to reach a level of community immunity. There remains enormous risk with the persistent gaps among young and middle-aged adults, many of whom are such an important part of our workforce. Looking at the totals in the rightmost column, you can see that the groups with the highest rates of transmission, hospitalization, and deaths continue to have the lowest levels of vaccination. With transmission continuing to rise, we do remain very concerned about low levels of vaccination among our Black residents and other teens and young adults. However, we're hopeful that the small increases on this chart will turn into larger ones as more adults and teens get vaccinated in the near coming weeks. In the meantime, complying with the indoor masking requirement will help us get back to reducing community transmission rates while vaccination rates increase. Slowing the spread not only protects our vulnerable unvaccinated residents, it also reduces the chances of more mutations that can result in more infectious variants that evade our vaccine protection. Take the next slide. As many know, the week before last, we issued a health officer order that required masking in all indoor public settings. This decision was based not only on the rapid increase in cases we saw in LA County, but also on the knowledge that most of these cases are caused by the Delta variant. The science on this variant shows that it is different from earlier variants of COVID. It replicates faster and more efficiently in respiratory tract cells, which means that infected people may now spread up to 1,000 times more virus particles with every cough, sneeze, or shout than they did a year ago. They may also spread virus efficiently 2 days earlier in their illness course than did people who were infected a year ago. A more infectious variant indicates infected people have more opportunities to transmit virus, and they can do so more efficiently before they realize they were even exposed. And while vaccinated people are extremely unlikely to get severely ill from COVID, there is a small risk of getting infected and transmitting the virus. This is why we're asking everyone to wear a mask, regardless of vaccination status. Since the health officer order requiring indoor masking went into effect on July 17th, we're obviously working with our businesses to make sure that everyone's able to be compliant. Between July 17th and the 23rd, we visited over 1,000 restaurants, bars, over 200 food markets, hotels, gyms, fitness centers, hair salons and barbershops, food manufacturing plants, personal care businesses, and shopping malls, among other businesses. And overall, we found very good compliance with the health officer order. And we want to thank all the businesses who are helping their consumers and their employees protect each other by requiring everyone to mask up. Next slide. The evidence continues to show that vaccination is offering the most protection from COVID, and we continue to make it as easy as possible for eligible LA County residents to get vaccinated by offering vaccines at many different sites across the county with almost no need to, at most of these sites, to have an appointment, and it's pretty much barrier-free as you come in to be able to get vaccinated. We have 772 sites this week offering vaccinations, and this is at pharmacies, clinics, community sites, and hospitals. Please note that many of these sites are open on the weekends and they have evening hours. And as always, you can check vaccinatelacounty.com to find a site near you. We can go on to the next slide. We're continuing with a strategy for improving access to vaccines by having mobile vaccination teams that can take vaccines to places where we can reach people that are not yet vaccinated. If you see these blue markers, they indicate the 322 sites where our mobile teams are offering vaccinations this week. Our mobile teams work to get vaccinations into the neighborhood places where people are gathering, and they're eager to make vaccines easily available to all of you. You can actually request a mobile team on our website, and meanwhile, please look for our teams at places in your community where people are coming together. Next slide. We'll always continue to share weekly information we have on vaccine effectiveness. This slide now shows data for those fully protected from the vaccines to scale. The large green box represents the more than 4.9 million residents who are fully vaccinated. The tiny purple box in the left lower corner of the screen box represents the 10,656 fully vaccinated people who tested positive for COVID as of July 27th, 2021. This is an increase of 63% since last week. I want to note that this number includes people who test positive because they have symptoms, they had an exposure, or because they took part in surveillance testing and had no symptoms at all. Of those fully vaccinated people who tested positive, 410 have been hospitalized. That's up from 287 the week prior. This translates to an increase from 0.006% to 0.008% among all fully vaccinated people who needed hospitalization. Deaths in this group over this interval also increased very slightly from 30 to 35, and that moves the percent of fully vaccinated people who have passed away to 0.0006%. Now that's at 0.0007%. These small increases, while indicative that fully vaccinated people do become infected and that more have become infected during the summer surge than before, still provide compelling evidence that fully vaccinated people remain at relatively low risk for becoming infected and even lower risk for having a bad outcome if they are infected. Next slide. These trend lines actually show what the numbers look like on a population level by now charting case rates among both vaccinated and unvaccinated or partially vaccinated LA County residents. As you can see, over the last few weeks, case rates have risen precipitously among unvaccinated people. While cases are also rising among vaccinated people, this increase is smaller and slower than it is among unvaccinated people. Our county's case rate would likely be much higher, probably double, if we didn't have so many vaccinated people. So we're extremely grateful to everyone who's helped reduce potential transmission by getting vaccinated. We can look at the next slide, which actually now has us looking at hospitalization rates among both vaccinated and unvaccinated or partially vaccinated LA County residents. And you can see that over the last few weeks, hospitalization rates have increased again significantly among unvaccinated people. Meanwhile, the increase among vaccinated people, while it's there, is much smaller and again proceeding at a slower rate of increase. Because these numbers are presented as rates per 100,000 residents, I do want to share the hospitalization numbers as well. Between May 1st and July 17th of this year, our county had 3,167 hospitalized COVID cases. 2,925 of these, or 92%, were for people who were unvaccinated or partially vaccinated, and 242, or 8%, were among people who were fully vaccinated. These trends do contribute to our certainty that vaccines are working as intended here in LA County. Although vaccinated people are seeing a rise in new COVID diagnoses, they're primarily experiencing their infections not as severe illness that brings them to the emergency room, but as bad colds. As the data shows, unvaccinated people simply cannot have the same level of confidence that an infection with this virus will lead to mild illness. We can take the next slide. Because we're really interested as well in understanding how our vaccinations are protecting us against the most severe outcomes from COVID, we're closely following differences in deaths between fully vaccinated and non-fully vaccinated people. In people who die of COVID in LA County, an average of 37 days pass between the date of diagnosis and the date of death. With our case increase having begun so recently, it's therefore too early for us to assess the impact of this latest wave of infections on COVID death rates. Nevertheless, I want to show you what we do know about deaths due to COVID by vaccination status. As the slide shows, between January 1st and June 30th of this year, 99.8% of all COVID deaths among LA County residents took place among unvaccinated and partially vaccinated people, while only 25 deaths, or 0.2%, occurred among fully vaccinated people. And although vaccines were approved during the entirety of this interval that we're representing on this graph, they were not widely available in the first couple of months of this year. And therefore, this graphic may not accurately represent our current situation because so many of the deaths that were represented here occurred in people who became infected before vaccines were widely available. For some numbers more representative of cases that have occurred since vaccines became more widely available, we can focus on the 3 months between April and June of this year. During this time, 485, or 96% of the deaths among people with COVID were in people who were not fully vaccinated, while 19, or 4% of the deaths took place among people who were fully vaccinated. Again, overwhelming evidence that the vaccines offer a lot of protection to people who are fully vaccinated. We can go on to the next slide. Earlier this week, I just wanted to touch upon the fact that the state issued a new health officer order that's aimed at preserving the safety of workers, residents, and patients in a variety of high-risk settings. A little less than 2 weeks ago, we issued a county health officer order requiring masks to be worn in all indoor public settings. I want to try to explain how these new requirements translate into better protections for workers. Prevention measures that have been strengthened include face coverings and PPE, vaccine status verification, and testing. The column on the left shows the standards that were in place for each of these prevention measures in the weeks before the latest health officer orders were issued. And the column on the right shows what the new health officer orders add that helps improve the effectiveness of each prevention measure. New protections conferred by our county health officer order are in the blue text, while those conferred by the state's health officer order are in the pink text. Before these new health officer orders went into effect, face coverings were required for unvaccinated employees indoors or in shared vehicles, with, of course, some exceptions, and for everyone while on public transit, at indoor use sites, including schools and camps, and at healthcare facilities, correctional facilities, detention centers, shelters, and at indoor mega events. Under the requirements of the new county health officer, face coverings are required for all employees and customers in any indoor public settings. This includes this includes work sites, and this is regardless of vaccination status. This does mean that vaccinated and unvaccinated employees and customers must always be masked when they're indoors. Another recent change relates to vaccine status verifications. Prior to the state's health officer order, self-attestation was permitted for verification of employee vaccination status at work sites. With the new state health officer order that was issued earlier this week, healthcare facilities and high-risk congregate settings are required to verify the vaccination status of their employees. They're required to ensure that unvaccinated employees are regularly tested, and they're required to provide certain protections for employees that are not fully vaccinated. One protection for employees is PPE. Before the new health officer order, employers were required to provide respirators upon request to unvaccinated employees indoors or in shared vehicles. They were also required to provide respirators when there were large outbreaks. While these rules still stand, the new state health officer order provides additional added layers of protection for workers at healthcare facilities and high-risk congregate settings by requiring unvaccinated employees to wear surgical masks in all indoor areas and recommending that these employees wear respirators in patient care or patient or resident accessed areas. Additionally, under the new state health officer order, unvaccinated workers must be tested at least twice a week in acute healthcare settings, skilled nursing facilities, and intermediate care facilities. And unvaccinated workers need to be tested once a week in high-risk congregate facilities and all other healthcare facilities. We can take the next slide. We're all grateful that our workers in LA County are back at work, and we want to make sure that our businesses thrive and stay open. Protecting workers is everybody's job. Employers, please make it easy for your employees to get vaccinated. You can request a mobile vaccination unit to come to your work site from our webpage, and please make it easy for your employees to have paid time off to get vaccinated. Adhering to Cal OSHA standards and the state and county health officer orders on masking and testing will also help reduce the risk that there will be infection transmission at the work site. For all of the workers, we thank you from the bottom of our heart for your service throughout this pandemic. Please help ensure safety by getting vaccinated if you haven't yet done so. If you're exposed to someone who's positive or ill with COVID symptoms, get tested. And if you're positive or you're a close contact of a person who's positive, follow the isolation and quarantine orders. If you feel sick, please don't come to work. And while you're at work or indoors, anywhere else in public settings, please mask up. If you aren't vaccinated, request a respirator while at work and adhere to the other Cal OSHA standards if you're in a healthcare facility or a high-risk congregate setting. As for all of us customers, we too play a positive role by wearing a face covering when we're inside a place of business and by not entering a place of business if we're not well. Let's maintain some distance from employees whenever possible. And of course, for those of us not yet vaccinated but eligible, getting vaccinated as soon as possible makes a huge difference. Keeping LA County's workers healthy allows our businesses to flourish, and this is good for all of us. We can make this possible if we all continue to do our part. Thank you, and now I'll take your questions.
And as a reminder, to be put into queue to ask a question, please click on the hand icon that's in the participant panel on the right side of your screen. Our first question will go to Stephanie Dazio with the Associated Press.
Oh, look, I haven't been here for a while and I still get the first question. Wanted to ask if there's any evidence that the indoor masking requirement is working. And on the vaccine front, do we have any surplus vaccine? And if so, how many doses have expired and are any in danger of expiring soon? Thank you so much.
Yeah, thanks so much, Stephanie, and I'm glad you're back. So, the evidence that masks will work, we'll need to wait 14 days out because of the long incubation period to begin to see the real effects of masking. We are definitely pleased that the rate of increase this week didn't look like what it looked like last week. And we're pleased with the high rates of compliance that we saw at many businesses and that we see so many people adhering to. So, our hope is that we continue to stabilize and then start to see a decline in cases. That could definitely be helped by high compliance with masking and by the increasing numbers of people that are getting vaccinated. In terms of expiring doses, I believe that maybe it was today or yesterday that we received a notice that for the J&J vaccines that were going to expire, I think, at the beginning of August. there's been a decision that those can continue to be used safely for the next 45 days. So no, we don't really have a problem with expiring doses here in LA County. We work closely with all of our vaccination partners in the state to move vaccines around with 750 plus sites. It's pretty easy to get vaccines that may be expiring soon over to sites that have folks coming in to get vaccinated. And so, I would say that any wastage due to expirations of vaccines here in LA County has been fairly low. So thanks for that.
Next, we'll go to Claudia Pescula with KNX.
Hi, I have a couple of questions. How much of a role do you think breakthrough cases are playing in transmission, and will the county be recommending testing for asymptomatic, fully vaccinated people following a known exposure? And then my second question, while hospitalizations are much lower now than they were in the fall, they do seem to be rising more quickly, which is kind of surprising given that so many seniors and other high-risk people are vaccinated. Is there any evidence that unvaccinated people who get infected now are more likely to get seriously ill? And what might this say to you about the virulence of Delta? Thanks.
Yeah, thanks, Claudia. Hopefully I got these all down. The contributions of cases among people fully vaccinated to transmission rates, not yet well understood, obviously very hard with a 14-day incubation period to capture that through our contact tracing. But there are, scientists and researchers that are looking at that very issue. And we certainly know that there has been transmission from people fully vaccinated to other people, both people who were vaccinated as well as those who were not vaccinated. It's not really clear exactly how much transmission is occurring. I will say that the numbers are likely to be relatively low in LA County, given that the highest proportion of folks that are at this point positive for COVID-19 are still occurring amongst people who are not vaccinated or fully vaccinated. In terms of the second question, we've already actually aligned our guidance to recommend that fully vaccinated people, even if they're asymptomatic on a close contact with a known case, should in fact go ahead and get tested. So yes, we're aligned and have changed our guidance for testing, recommending, again, people fully vaccinated with no symptoms who are identified as a close contact of a positive case should go ahead and get tested. Those folks, however, are not required to quarantine if they don't have any symptoms, but they need to watch themselves carefully for the development of symptoms during the 14-day incubation period, and of course, immediately isolate themselves should they develop symptoms and get tested. In terms of the last question, which is what do we know about hospitalizations that are occurring now? It seems like there's been a dramatic increase in the number of hospitalizations. As I noted, the ratio of cases to hospitalizations is much lower now than it was during the winter surge, and even during the last summer's surge. But we are looking to get more detail on exactly who is hospitalized. We know that a small number of the people who are hospitalized and counted as a COVID case are in fact in the hospital for some other procedure, a hip replacement, some other medical care that's necessary, hospital screen on admission for COVID, and there are some patients who are testing positive upon that admission screening. And obviously, as community transmission increases in the county, the percent of those people on admission screening who are getting a positive test is likely to go up a little bit as well. But we're working to actually be able to get, primary and secondary diagnosis data with our hospital partners so that we can be able to report out at least some preliminary data in the next week or so about who's hospitalized, what percentage of them are people sick with illness related to COVID, and what percent of them may be in the hospital for some other reason. But thanks for that. We'll take the next question.
And that'll come from Ryan Carter with the Daily News.
Thank you. Hello, doctor. Thank you for sharing the information today. So I think you were sort of tapping into my next question, which was maybe if you could explain more formally why it is a challenge, or if it even isn't a challenge, to offer data in the daily numbers, vaccinated versus unvaccinated in the case numbers. Like that seems to be a continuing question among our readers too.
Yeah, no, thanks, Ryan. So there's two different databases. One's the database that, are people, our test results from people who have been tested, and we get the number of negative test results and the number of positive tests. And then, our team cleans up that database to make sure we don't have duplicates that have come in. And then there's a database that you get for people who are vaccinated. In order for you to be able to tell amongst your new cases which one of them are occurring among people who are vaccinated versus people who are not fully vaccinated, you actually have to merge those databases, and they're entirely separate databases, and you have to use an algorithm again in that merge to make sure you're being fairly accurate. So it's both a pretty lengthy process. It's also still requires some manual manipulations to make sure the databases are clean. That's why in a county as large as ours, with, as you noted, hundreds of cases every day that we report that are new cases, it would be hard for us to do this on a daily basis with our numbers. But we're hopeful that, we do report this out on a weekly basis, that at this point is providing us with fairly good information. But appreciate the question, and thanks for asking.
Our next question will come from Taylor Torregano with Spectrum News.
Hi, Dr. Ferrer. Thank you for taking my question. I just wonder, my question is directed towards schools, K through 12, and I wonder, we saw that you have new recommendations, but we are trying to see if there's any serious consideration of closing schools once again. Will there be another stay-at-home quarantine? Are you considering this?
No, there's no consideration for closing schools. I mean, we're all working really hard. I want to thank all of the educators, teachers, staff, principals, superintendents. I want to thank our partners at the LA County Office of Education. People have been working all summer to implement the safest possible reopening for full in-person instruction at our schools. And that seems to me to be completely possible. There are safety mitigation efforts, obviously, that are happening at every school campus. Everyone has to play their part: parents, students, staff, administration, to create as much safety as possible. There's an indoor masking requirement, which will go a long way towards reducing transmission of people who are possibly infected without any symptoms. You saw that there's a long list of recommendations for schools to implement as they add additional layers of protection. There's opportunities again, to do what we know works really well: infection control, distancing where it doesn't interfere with your normal operations, making sure that there's a good plan in place once cases or 8 cases identified. Our teams are here. We have an entire team of folks that are dedicated to assisting schools in any kind of cluster, when they have identified any kind of clusters or with any outbreaks. So we're all prepared to do our very best together, keep schools open. I want to thank all the parents who have gotten their young teens vaccinated, and of course all the teens that have gotten vaccinated, and all the teachers and staff that have gotten vaccinated. I mean, we've seen over and over again that vaccinations is a game changer. So when we reopen this fall, we've got the most powerful tool still available, and it helps to have staff and adults in the building vaccinated, where you have small children, and in those high schools and middle schools where you have a lot of teens that are vaccinated as well. This is all going to help us be able to keep our schools open.
Next question will come from Mackenzie Mays with Politica.
Hi, can you hear me?
Yep.
Hey, so Taylor actually just asked my question about schools, but I did want to ask if you would recommend that schools require proof of vaccination of teachers and other employees the way that we are for city and state employees.
Yeah, it's a great question. And, we have, I think, 80 school districts here that will need to look at how to, in fact, think about vaccination verifications. I do want to note, and I again want to thank all the school districts, just about every school district has got already a robust testing program that they're rolling out in the fall. So, the recommendation that exists so far is, people who are fully vaccinated don't need to necessarily participate in that routine testing, but that you should be able to offer it for people in your school community that are not fully vaccinated. And, most of the school districts will have that testing capacity when schools open. And I think the districts will have to, examine for themselves and work with their labor partners on that verification process. The most important piece to this effort, I think, is being able to encourage everybody who is eligible to get vaccinated. We can take the next question.
All right, we'll go to Marla Tellez with Fox 11 News.
Hello, Dr. Ferrer. Thank you so much for having this briefing and taking our questions. I have two sort of explainers. So looking at the map of LA County that shows the current location for the surge, and you said that these are the more affluent neighborhoods. So can you kind of talk about the discrepancy of those seemingly had the higher vaccination rates, those particular neighborhoods? If you could talk about that, and now that they do hold a lot of these new cases, I'm interested in that. And then also, I interviewed an infectious disease specialist from Cedars-Sinai today, Dr. Gandhi, and she was speaking to the fact that hospitalizations there, she's seen a lot of 20 to 40-year-olds. And it's really, if you could just elaborate on the fact that it is that age group that is not just getting COVID, but really, really sick. And at that point, regretful that they didn't get the vaccine. Thank you.
Yeah, thanks so much for both questions. In terms of the current locations that we were highlighting, those are communities that have seen a lot of increases in their case rates. I want to be as clear as possible that case increases happening across the board. I was looking the other day. I don't think there are really hardly any communities of any measurable size that haven't seen a significant increase in their cases. So everyone has seen increases. These were just some of the communities with the highest increases. And when we looked into who was infected in those communities, what we saw were lots of younger people who were infected. And again, every time I put up the data, it's crystal clear that vaccination rates among younger people across the board in LA County are much lower than they are for older people, and with many more opportunities for intermingling. And I think particularly for people with resources who now can go out and about more, everything's open. You could spend an evening at a bar, you could spend an evening, at a restaurant now, indoors as well as outdoors. You can go to large parties. For people who aren't vaccinated and aren't taking any precautions, when there's a lot of community transmission, there's a lot of risk. And we have much lower rates of vaccination in these younger populations. And so, I don't know that it's so surprising that we're seeing the increase there because in fact, with resources and opportunity, there's probably more intermingling in some of these communities than in other communities. And particularly, there may be more intermingling indoors in higher risk settings for people who are not fully vaccinated. And I do appreciate the notice that, you know, we have a lot more younger people hospitalized. Last week, I did show some data, or yeah, I think it was last week, that showed, you know, who's in the hospital, what do the trend lines look like, where have we seen increases in hospitalizations. You know, unfortunately, older people who do get sick are still more likely to be hospitalized. But you're absolutely right. You know, for the first time, we have many more younger people, particularly, you know, in that age group of, you know, really we call it 18 to 49, who are hospitalized at a higher rate now than they've been before. And again, you know, much less likely to be vaccinated. And while, you know, in general, younger people are healthier, and that contributes to the fact that we don't have the same rate between cases and hospitalizations as we saw during the surge. This virus causes really, really serious illness among both healthy people and people who aren't so healthy. So for everyone who's out there not yet vaccinated, you know, the virus can make you very, very sick. And that's what we're seeing in our hospitals now. So thanks for that.
Unfortunately, we're right up against our time for today. Dr. Ferrer, you have any closing comments?
No, just again, always my thanks and deep appreciation to everyone in the media. Thanks for, you know, making sure information is getting out to all of your listeners and viewers, and appreciate everything you're doing.
Great. Thank you for joining us today. If you would like to stick around for Spanish comments, we'll begin those at 3 o'clock.
I'm a host now, and Monica's already in there.
You have her slide.
I do.
Okay.
And we should be ready to go. We'll walk over there and check on her. I'll give her a minute.
Yeah.
We're gonna start. We're gonna start at 3.
Yeah, I didn't tell them.
I'm ready if you want.
Wait, start at 3, or do you want me to start sooner?
I would start at 3.
Okay.
I'm ready, King, if you're ready.